It is so surprising how majority of us have endangered our life these days. We put ourselves into trouble with our own mindset, our own perception, and our own thinking, which is not even supposed to be so. Most of the time, we end up being the cause of our problem. We start running to hospitals to seek for help, or start running to people to seek for help that is not even supposed to be done. When you take good care of yourself, honestly, all that thing will not come possible. Some of you harm yourself by self-prescription, and even sometimes, some of us will even find ourselves diagnosing ourselves when you are not even a health practitioner. You see that sign you feel in your chest, and you feel chest tightening. Sometimes you even feel it at your elbow, or sometimes it radiates to your back or to your shoulder. All these signs, it shows that you are at the verge of having heart attack very soon. In some years ago, it was recorded about 17.9 million of people died of heart attack. And this condition is presently the commonest cause of sudden death of our youth, our parents, our brothers and sisters out there worldwide. You see that pain you have in your chest that sometimes it radiates to your back and it makes you uncomfortable. Sometimes you lie down and you feel like it eats you up. Sometimes you don't even know the kind of position you are supposed to put yourself. Sometimes when you lie by the left side or you lie by the right side, it's keeping you. Or sometimes you can't even bend because you feel that bones over you. And sometimes these pains you get relieved by it by taking some painkillers or some medications. Or sometimes you have to take enough rest or you sleep that before this pain can relieve you. This could just be a sign of myocardial ischemia, that is insufficient supply of blood to your heart. You see that epigastric pain you've been treating over years that you think is a peptic ulcer disease. You are just playing with yourself with a wrong diagnosis. That could be a sign of cardiovascular disease, which is the heart attack that has killed majority of the population nowadays. Please, you see that smokers, alcoholics, people who take unhealthy diet, you take or you consume heavy salt in your food, you are at the greater risk of dying from heart disease. If you have an experience of shortness of breath, dizziness, general body weakness, sometimes you become very weak and before you know it, you get the strength back. Or sometimes you feel lightheaded pains and breaking of cold sweat, and before you know it, you get recovered easily from it within a short period of time. This could be an impending sign and a great doom of heart disease. Amongst the people that are of greater risk of having this cardiac disease are our youth, particularly our males. Even sometimes the females too are not part of it. They always want to get high on drugs and take some medications. You see all those injectables and drug being abused can sometimes lead them to infective endocarditis. This is because on the process of taking those drugs or injecting themselves with those drugs, they get themselves infected with bacteria, and these bacterial infections, once they get into the heart, they go directly to attach themselves to the valves of the heart and they get it blocked. And once it's blocked, it will result them into sudden cardiac failure if not treated. The abuse of drugs like quinine, chloroquine that is being used in treatment of malaria in a low-income economy or in an underdeveloped country like our country Nigeria can result to sudden cardiac arrest. Despite the fact that we are all predisposed to malaria in this country, you have to be very careful when you are treating for malaria because high dose of those drugs or abuses of those drugs can create other problems and lead you to heart diseases. If you don't take care of your heart and you develop all those heart diseases, you will suffer. The government will abandon you. The public will abandon you. Your friends will abandon you too. The health sector will also fail you. The clerics will exploit you and take a lot of money from you. You will get swollen and community like mine will begin to stigmatize you and then begin to call you a witch or a wizard. I have seen someone who have Anasaka ostracized. They claim he has offended the gods of a certain river. So everyone in that area believes that the gods decide to pump him with a lot of fluids, whereas this person is having chronic renal syndrome. Please and please, this is what I can do for you. This is what I can tell you. And this is what every other health practitioner are supposed to tell you. Eat healthy. Do a lot of exercise, move around or take a stairs. This will help you. Always be committed with your regular checkup. Avoid alcohol intake. If it is self-prescription of drug, leave it behind. It doesn't fit you. Reduce your salt intake. Eat a lot of vegetables and rest well. Sleep not less than 8 hours a day. This will help you in a long way and help you to improve your health. Follow all of this. Seek guidance. Always ask questions regarding your health. That is why you always have us to drop your comment at any time if there is anything bothering you or anything you want to make clarification regarding your health. Remember, I am always here for you. Drop your comment and drop your question. Don't forget to share this video to your friends and family because they might also be suffering from this heart disease.